Hi, I'm Jeanette.
I'm Musadine.
We're back again this week for a wonderful topic. Last week was so good, Musadine.
Yes, it was.
Abuse and neglect was really a hot topic. We had quite a few people tuning in. Today we have another informative show, and we're going to discuss accessing Medicaid services. How do you do that? How do you begin to apply for Medicaid? What that process is like? And then I think as we talk about services that are available through Medicaid, I think it's also important to talk a little bit about Medicare and what the difference is between those two, and how do you know what services you can access using either Medicaid or Medicare. So this kind of came up for me, Musadine. My dad is 81 years old, and he has Medicare. He at the time was 80 when he was in the hospital, and he had to have home health because he's a heart patient, and they were cautious about sending him home without having someone there. With our work schedules, we could in the evening pick up some of the time with the rotation systems between myself and my siblings, but they were like, nope, you got to have someone there during the day. And by the way, we want to be able to monitor him. So we're going to send home a couple of devices, hook it up to the screen so we can pay attention to his heart. Decided that he needs home health, has Medicare, so he was able to get the service. Medicaid is a whole nother beast because in-home services is what he was wanting to get, but didn't have Medicaid. So was not allowed to access Medicaid. And then we started the application process, and that was, Musadine, that was long.
Yes.
Very long. Like, I think the initial application took us 3 hours. So my question to you, that was my own journey. Is that a standard process for families trying to access Medicaid? Yeah. And then you might want to define it a little bit. Help me through this, please, if you will.
Okay. I've learned over the years, just doing business and being in that realm of things for Medicaid recipients. So that's who we service predominantly. Medicaid pays for services for in-home care. They call it home and community-based services.
Home and community-based services.
And so, again, to qualify for Medicaid, I'm going to start with Medicaid first because that's kind of what we do. Okay. You have to be under income guidelines. So literally for a single person, I think it's like 1,000. I think they just raised it. It might be 1,200.
Okay.
Is that what you got recently?
Well, I thought they raised it.
Yeah.
To, it was 1,049 or something.
Yeah, it was very low.
Raised it.
So, needless to say, you can't make lots of money to be on Medicaid. And if you did make maybe $1,700, you may have a spend down. And so that's spend down is something you have to pay before you get services. It's kind of like a copay. Every month, say you made $1,700 and you did get qualified for Medicaid, you will have to pay that spend down before you get any services. That's even doctor's visits or even the home care, home community-based services. And so, again, if they may say you have $300 spend down that you have to pay every single month.
That spend down, is that rate prorated above the income guideline that you're able to earn or have each month? So if you make above the income guideline, that amount, whatever that amount is, $500, $600, is that divided out over a 12-month period? Or is that so you pay a little bit each month? Or is it a one-time shot in the arm?
No.
Okay.
It's every month. So whatever that amount is that they will calculate as your spend down, you have to pay that.
You have to.
And usually we tell individuals, if you want for your services to be active on the 1st, you need probably to pay it within 5 days before the 1st. And so you can get your services in the system activated. Just because, especially if you're mailing it in, I'm not sure if they have access now online, or you can just mail it in.
I know if there, I do know that if you do mail it in, or if there's a delay in that process, you still won't receive services. That's even correct. If you've mailed it in advance and you're confident, like it might even be 2 weeks prior to the 1st, like the middle of the month, and you send it in. But if the state didn't receive the payment, then, or say they had not received the payment, you still would not be allowed to access services.
That's correct.
Wow. I only know that just because I've been working with
these individuals. Yeah.
I think had I not done that, I wouldn't have any knowledge of it. But and it is it's a process, really. So I just want to make sure people understand that when you apply for Medicaid, that the application process you can do it online, and you can do it by phone.
Yes.
But even if you do it by phone, it doesn't guarantee that you could be on the phone 3 hours. Like, it is not correct. I'm going to call and I just get signed up. It really does not work that way.
Because you have to wait for them, first of all, to be in the queue, and that can be a long time. It can be an hour wait, like anything else governmental. And then once you get all the information in, you still have to provide information, such as your bank statements for the last 3 months. And if you have any burial insurance, they want everything, every asset that you have.
A pension that's provided back.
Anything.
It has to come from, if I'm not mistaken, I believe that it has to actually come from the entity, that governmental entity. So if it's a bank, it has to be from the actual bank. The statement has to come from that bank, and it has to be sealed and stamped from
Not
that
necessarily.
bank.
You do have to bring your statements. So you can go and print your statements from the bank, and the bank gives it to you, but you have to have 3 months worth of statements. So
but it has to be
3
something
months.
that it has to be like if you bank, I don't want to name any banks, local banks, but if the bank letterhead, I mean, it has to have their letterhead information on there. It has to be able to show that it comes from that institution.
That's what they told you to do?
That's what you have to do.
Well,
when we applied and they needed the statements, he couldn't provide his. We had to go physically to go get the actual statements. And then we needed to go, he had a pension from the city where he was employed, and we had to go to the city, Kansas City, and get his actual pension account from a sealed letter saying this was his amount. Because they were saying that was a holdup, why we didn't have it. So even though we went through a 3-hour wait, and that's meaning when my dad was walking through this process, he still was not able to just get it. It still took a little bit of while.
Well, yeah, from my experience, usually, because I help a lot of individuals get it, usually I tell them to go get 3 months of bank statements. And then if they have a pension, because I had an individual who had a pension, we just had them fax that information to us. And then I just went on and faxed it back to the Medicaid system. So I think somebody can kind of give you the runarounds, really.
No, we physically, because we did it by phone, then we physically went into the State Department in downtown Kansas City. And when you go, I want to share this information because I think this might be helpful.
Yeah.
When you walk into the state building, you don't, it's not, you'll get in a line, but even when you go back, it's just a bunch of phones. It's not an actual it's not what, I thought it would be like a person sitting at a desk that will help you. It's not. When you go to the back after you answer your initial questions that the receptionist is asking for, they'll then check you in, and then you go wait in the back, and then they once again call that number. It's another number, and you sit at a phone, and you have to wait. You will sit at a booth where there's a phone. You go in this room, and each booth has a phone on the wall, and you're waiting for that worker to call your booth.
Okay.
It's not what you think. I'm telling you.
That's a post-COVID thing, I guess.
Oh,
no one wants to talk to anybody anymore.
It's not a human. I know. It's like,
everyone doesn't want to talk to anyone. So, yeah, I think it's better just to do it online. Then get your paperwork gathered and submit those. You can upload it to the online system, and then they have it. The thing is, you just be waiting for that response, and it can take up to 30 to 90 days to wait to see what their response is. So you're not immediately getting home, care,
And don't be
for Medicaid.
surprised. Is
But-
it fair to say even after 90 days, if you don't get a response, even with verifying, that you
Yeah.
still may not have an opportunity to hear from someone?
But there could be hope, because Medicaid will go back 3 months to pay your doctor's bills or any medical expenses that's been occurred.
And that's a good thing.
So that's a good thing. So you can't just give up. Be persistent in trying to get the Medicaid. But the Medicaid does help individuals get medical care, which is great. And then they help them with home and community service base. But even going into the community home and community service base, you have to qualify for those services, by the way. So in terms of that, you just don't have Medicaid and say, yes, I can get help in my home. There's someone to come clean up, someone to cook for me, someone to go do my errands, and type of thing. But you have to qualify in terms of a point system too. So that's another process. That's for another day's service conversation. But to go back into the Medicaid, again, you get Medicaid, you are on Medicaid pretty much for life unless your income changes or you did not renew your Medicaid. So you get a renewal letter in the mail. You have to update that every year. And some people lapse because they don't know what to do. They don't fill it out. And so they don't have Medicaid.
That's important,
and it
too,
says
yeah.
inactive, so you can't get services.
Oh my God, yeah, that's real true. That really will happen, and you're interrupted. And
Yes.
and again, that renewal form is long. I think that renewal form is 7 pages. It's long.
Whatever it is, you have
and you have to be
submit.
careful, and you have to make sure you answer all the questions on that renewal form to make sure you get it back,
Yes.
to make sure and turn it back in, and then follow back up with the state just to
Yes.
make sure. Yeah.
Yeah.
Wow. It is lengthy. Just sitting here, I'm kind of processing
Yeah.
this mentally. So you use the word, I know we went over the show like a couple of weeks ago, stamina,
Stamina,
right? Persistence.
Yes, persistence.
You do have to be persistent to be able to work through the
Yeah.
agencies. Thank you.
And you just can't give up. You got to be patient through the process. So that's the Medicaid piece. And anyone can get Medicaid, by the way. Just going into children have Medicaid. They have them different categories of Medicaid, but Medicaid is state funded. I didn't go over that before, and that's what the monies that are allowed for the state is being divided out per individual. Okay, and you asked about the Medicare, so I'm gonna now go to the higher end of the spectrum. Medicare is for individuals that have worked sometime during their lifetime, and they have to have a points system. I don't know how many points you have to have by the time you retire or whatever, or quit working, disabled. But you will get Medicare then. So you have some individuals that are young, they will get Medicare because possibly they were a dependent of a parent, that had Medicare. And so they get the benefits of the Medicare from the parent. Okay. And so that's how the younger people will have Medicare.
And I want to make sure I clarify this. You would draw benefits under your parents' social security number. So even if there's deceased, you would go up under their number and be able to access those funds.
Right,
Okay.
exactly. But otherwise, the typical Medicare is for individuals that have worked and they're 65. I believe the number is 65. I don't think it's moved to 67 yet. And older, then you qualify for Medicare. So Medicare is the red, white, and blue card. I always try to make it specific, and that's federal, okay?
Medicaid.
Medicaid is state. Medicare is federal.
Okay, good.
Yes. So that's federal dollars that these individuals have for health care. And so when they get that, Medicare has encouraged a lot of individuals to go and get the supplement, which is like a spinoff. It's Medicare Advantage or Medicare Blue Cross or Medicare Humana,
So
Medicare United Healthcare.
Is it fair to say you would look at it like primary and secondary if you're in the marketplace with insurance? So I have my primary insurance, but then you go access or you have access to a secondary. Is that the kind of a way to look at that?
Exactly.
Okay.
So that means you have 2 insurances. And anytime you have 2 insurances, you have to use your primary insurance first. So when you go to the hospital will bill the primary insurance first, and you might have a copay. And so Medicaid will kick the payment in for the copay.
Now, is that something that you share if you are going into the hospital, that is something that you share with your provider, and should that information already be on file?
No, usually it's not on file.
Okay.
You have to have that on you at all times, because if you were admitted to the hospital and they do not have insurance information on you, they have no way to find it, you know. So you need to have something to find it. So sometimes, but because Medicare have changed now, they used to be Social Security numbers they were using for Medicare, and now they give you some alphabets and letters and everything. So it's difficult just to go find that person's individual's Medicare information without a card or something. I'm quite sure there's a system possible you could probably put a social in, but I've found, you know, recently it's hard to find those. So hopefully you have something that's on there that has Medicare, Medicaid, something written, you know, a card. A card always helps, you know, for the hospitals. But
So I just want to kind of go backtrack just a little bit. So the red, white, and blue card is the Medicare card, and Medicaid red card.
it used to be red long time ago.
It's not a red
It's
card
not
anymore.
red, it's white
Okay.
now.
It's a white card.
It's a
Okay.
white card now. And it has like I don't know, like a little flower thing on the top. I don't know the description, but it will say, if you're in Missouri, it will say Mo Health Net.
Okay.
Yeah.
Oh, hell no.
Mo Health
Now, what happens if are both services for the, no, you said Medicaid can be you can have it as a child, birth all the way up.
Medicaid.
How about Medicare? Is there age requirement for Medicare?
So that's what I was saying. Unless the younger people that have Medicare is because they're dependent of someone. If they're not a dependent and they've never worked, so they can't get Medicare.
Cannot.
Yeah, you have to be a dependent of someone that's disabled or already have Medicare to tap into those benefits. So say if, a young child, their parent passed away that had Social Security, that Social Security goes to that child now until they're of age to go to work.
Okay. And that, do you know what that age might be? Is it 21?
I'm not sure if it's moved up to 21 or it's 18.
18?
Yeah.
Okay.
Yeah.
That's something to look into.
Yeah.
Right? Okay. Other thing, that's really good information. Let's talk about, we talked about home and community-based services that we can access through Medicaid.
Yes.
Okay. What other services can be provided for you if you go into the doctor with either service? So, like, for example, home health was provided for my dad with Medicare. So what services, if you have dual insurances, can you expect to receive? I mean, are we talking about physical exams, specialized? Sometimes you have to have specialized testing if they're looking for. You might go into have your annual exam, and then the doctors say we need to test something specifically, have labs ran, or you need to go in for MRI or something that's more specialized, and so you have to have those services. Is there, or I don't know, if there's an injury, maybe you have some type of accident or sporting injury, and it's specialized services. How do you know what services cover what? Or is it just fair to say it's going to always be primary?
No.
You know what I mean? Your primary insurance.
Yeah. Again, because you have Medicare, it doesn't give you the option, I would say, for every single thing. Okay. There are more opportunities for Medicare versus Medicaid.
Okay.
Medicare pretty much pays for everything you can think of, you know, literally.
It's pretty much 100%
Yeah,
if
it's
you get it.
100%.
Okay.
But again, it goes again with possibly there's a copay, you know, and that's when Medicaid will kick in, as I said. But when you go for Medicare now, let's go back to the flip side of the home and community service base. They do not pay for that. So you can't get in-home care services in the home, such as personal care, light housekeeping, light meal preparation, the things that we do, errands, you know, that type of thing. They call that non-custodial.
Wow.
So it's not skilled. Medicare will pay for skilled services such as physical therapy, occupational therapy, speech therapy in the home. They'll give you a bath aid, home health aid. They'll call it home health aid. But that individual only comes and do a bath and then leaves. That's it.
They won't
So
sit with you for an extended
they're not
time.
gonna sit with you.
And
It
there's
could
no
be up to
special plan,
it could be
right?
15 minutes to an hour.
Wow.
Once they're done, they leave the home.
Mm-hmm.
So they're not gonna be sitting there and holding your hand and babysitting you. That's where home and community service-based services come in, where you can get the assistant. Someone can be there a little bit longer for you. It's a long-term relationship, I call it, versus home health. It's usually every 6 weeks you have to make up another plan. So you can have a plan initially and get better, and then you're going to fall off. Okay, so the services fall off. So it all depends on needs, medical necessity. That's the word
really
they use.
the goal when we talk about in-home care, Medicaid, or home health, Medicare, the goal is to decrease the number of hospitalizations. Is that fair? You want
Yes.
to you want to keep the. Now, tell me if I'm wrong or not, or if I'm off base. The person is typically older, not always, but typically older, 65 or older, and they probably have been in with. They've had some medical concerns.
Yes.
And so, because of that, you're trying to decrease the number of hospitalizations and keep the person in their home functioning independently for as long as they can,
That's correct.
and for them to be healthy. So both of them serve the same purposes. But the key to it is who's going to pay
That's right.
and how long you're going to be allowed to have the services or the additional help in your home. And so therefore you do need to know the difference between the state versus the federal programming.
That's correct.
Thank you so much for that's a lot of information.
A lot of information.
Oh man. So tell us where do you have the website? Do you know the websites for either? I kind of put you on the spot, but they could Google them as
They can
well,
Google
right?
them.
It's because it's a big machine.
It is.
That's the way I think
It's
of
a
it.
lot.
It
It's
can
a
almost be overwhelming a little bit when you're starting the process. But go ahead. I'm sorry. I didn't mean to interrupt you.
From Missouri, I believe is dss.mo.gov for Missouri for Medicaid. Again, it's dss.mo.gov for Missouri. As far as federal, that's another bill of wax. So
But
you
you
just
would
have
be
to go
able
to
to-
your local,
you
a local Social Security office, and you can start the process for Medicare, literally, if you wanted to do that. I think a lot of times Medicare will contact you when you're getting close to that age and saying, it's time to file for Medicare benefits.
They will contact you. Oh, that's good to know.
Yeah.
So don't throw those letters away
No.
when they come in the mail.
Don't do that. You need to get your Medicare.
And if you do have Medicare, when it's time to renew, don't throw those letters away either.
Medicaid.
Medicaid.
That's the Caid.
Medicaid.
Yeah, Caid.
Okay, thank you, Medicaid. Is it common that people get these mixed up?
Oh, for sure.
Average.
Oh, yeah.
That you wouldn't know this unless you had to be able to access the system. Is that
Yes,
fair?
yes. Oh,
Okay.
yeah. A lot of times. When I did home health services, I used to have people that only had Medicare call and says, my insurance says I can get these services, like someone to come to, clean up my house and all this. And so it was so heartbreaking to call with the individual on the phone because their providers, the company would tell them they are qualifying. They call it home health.
my
Everything is
God.
considered under home health.
Got
And there's a difference. There's a home health, which is skilled, PT, speech therapy, a bath aid, and you have home and community service basis, which is non-skilled, non-custodial. So if you were to ask your insurance, I please encourage you to ask them non-custodial. Does my insurance cover non-custodial? Because they put everything under home health umbrella, and these people were so crushed when I told them this is not it. And so we had to even prove it a little step further to call the insurance with them. And they would say, well, yeah, that was told to you wrong, I felt bad for them. And then I said, I'm sorry, I just wanted you to know the difference, So I was more into educating that individual. But we used to have so many of those calls because of misinformation.
It's really kind of hard to stay on top of this. Do you think that it's important to be able to have your adult children or grandchildren be able to kind of help you navigate I mean, is it okay to then look at them and say, I really don't know what I have available. Can you help me?
Yes.
Or your spouse.
Yes.
One, usually, if you're, I don't know if it's common for spouses to go through at the same time. I don't think, whether it's retirement or one gets sick. We know that happen. Real life doesn't happen
Right. Together.
simultaneously. I mean, rarely that happens like that. Typically one gets sick or the other one doesn't, something happens, life happens, and then you're faced with having to really look at it and answer these tough questions, and then try to navigate through. But let's talk about educating ourselves. So what can the adult children do, or if you're taking with parents, how can we get a hold of this Medicaid, Medicare system, if there's even something, if it's even possible to get ahead of it? What can we start doing now?
In terms of, again, it all depends what the timing, in terms of when you're gonna need that, those type of services. It's really hard to say. And as I look back just on different services that each one of those provide, it's good to have both. But again, if your income is up to there and you can't qualify for Medicaid, the best thing is to start saving your money so you can have care in your home.
You can take care of yourself.
Exercise, eat right, all of that. But one of the things I like to really educate people on is you have assets, okay? As we are right now, we have assets. So what happens is, if we get to a point that we need Medicaid, they're going to look at your assets as this is yours, and so you do not qualify. Okay.
Ooh, so that doesn't even necessarily mean
that's
money.
another spin.
So if I have a car, a home, anything like that, they're gonna.
It's counted as your assets.
Man.
And so I'm not. I'm somewhat of an expert on this because I've gone through this with several people, but they tell you to get a lawyer to put everything in a trust. Okay. In order for you to get the extra services that you're going to need when you get older, if you have a trust, this is no longer yours. It's going to be in the trust. And so you can get Medicaid services by having all your assets in the trust. That's another day's topic.
But that's an expense, right? That's
it is an expense with the lawyer.
Oh wow. Okay, that's another topic another day.
That's
okay.
Yeah, that's
because I didn't know that. So if I have assets,
yes,
as I'm aging and I'm starting to think, and something suddenly happens, I may not qualify.
No.
And so then I now have to begin to start thinking about how am I going to take care of myself, or my spouse, how I'm going to take care of me and my spouse, or vice versa.
Yes.
And then I have to let my adult children know, or nieces and nephews or grandchildren, whoever is the person going to be responsible for looking out for me.
Yeah.
Those are, oh my goodness. Okay, that's another topic. I think I want to look into that.
Yeah.
I didn't know that. I learned something today. I didn't even know that.
Yeah, and even if you did have assets, such as a home, Medicaid has a rule out there. You sign this when you sign up for Medicaid. It might be in small print, that if you pass away, those assets come back to the state if they've given you money.
Wow.
So this happened to my mom.
Really?
Yes.
So you want to be careful with what you sign.
Yes. If you need the help, you need the help, but there's a twist to this whole thing. You have 5 years to literally give your stuff away before you need Medicaid. So you can give all your assets away within 5 years before you need the help.
Wow.
So you start now. Just start giving your stuff away. Put in your children's name.
It's going to take me probably 5 years to wrap around it. To mentally,
put in your kid's name right now.
It's going to take me 5 years mentally to kind of just mentally wrap around what I need to do to prepare for this reality.
Yes.
Okay.
You start now.
Now, because at some point, unless you work forever, unless you're self-employed, that's not realistic. Because at some point we're all going to retire.
Yes.
You know what I mean? You're going to retire, and so you're going to end up in one of the systems, or is it where we have to find our own insurance? in the marketplace where we.
Yes,
but then even still, sometimes that's
unless
not
you're 65, you'll get that Medicare.
Medicare. That's what this topic is.
Yeah, Medicare. Yeah, you'll get the Medicare.
Okay, that's what we need to do. But we got to make sure about. We got to come back though.
Yeah.
We're coming to the end. This has been a great topic, Ms. Dean. I appreciate you taking out your time today and sharing all of this wonderful information. I've learned a lot just walking through the journey. And I'm sure people you don't realize what you need until you need it.
That's
you know
right.
what I mean? Like, you don't even know. I just think there's so many things out there that personally I'm just not aware of until I'm on the course, and now I'm trying to navigate this going, oh, I didn't know that. Oops, I turned here. But I think if I can, I think this is good information. If we can get out ahead of it, even if we don't have all the answers, at least we can begin having the dialogue, right, with our family members and our loved ones and talk about things that we can do. Ooh, good topic today. Good topic today. So do we want to tackle the subject of a trust next week?
I'm not very expertise at that. I'm working on it, but yeah.
So it would actually give us time to actually go back and look over what, I don't even know what a trust is.
Oh yeah.
I don't even know what it, like, I just think I trust people. Like, I don't know. But if I need a lawyer to do that.
You need a lawyer to do that.
Okay.
Yeah.
So anyway, we gotta come back next week and deal with this whole
deal with that another day.
Because I don't think I know. Oh my God. I am Jeanette Bush with Courageous Home Care.
And I'm Musadine Harold, Courageous Home
Care. We will
Care.
see you next week where we will discuss trust.
Okay.
Thank you.
Thank you.